Hello, my name is Jeannie Miner. I'm an RN here at the clinic, and I'm going to be assessing my patient from head to toe. First of all, I'm washing my hands so that I'm not transmitting bacteria from one patient to the next. I have already cleaned my stethoscope, but we can certainly do that again. We've sterilized our stethoscope now. So, hello, Mr. Smith. My name is Jeannie.
Nice to meet you.
I'm an RN here at the clinic. I'm going to be doing your head-to-toe assessment today. It's going to take us probably about 10-15 minutes. And we are going to be filming this, but it is going to be completely private. No one else will be able to, view your video if that's okay with you.
Okay.
I am going to be turning it in for a grade though, so my teacher will see it.
Okay.
Okay. Is it okay if I call you
John?
John? Okay. All right, John. So what we're going to do first is we're going to start, we're going to go kind of head to toe.
Okay.
Okay? So first what I want to do is I want to go ahead and check your vital signs real quick.
Okay.
And we'll do that. And if you'll just sit there with that, just about like that.
Mm-hmm.
Okay, so your pulse rate's about 80. Is that about normal for you?
I think so.
Okay. I'm going to check the temperature. His temperature feels normal across the top of his forehead. He also feels normal on his appendages. So I'm actually checking temperature throughout. I'm going to go ahead and check his pulses real quick. His blood pressure is 147/93, which is a little bit high. I know you, and I know you're pretty fit usually, and this is not your typical blood pressure. What do you...
I had a lot of coffee.
Oh, okay.
And an energy drink earlier today, so.
Well, that's probably what's happened then. So, I'm going to go ahead and check your pulses while I'm standing here. I'm going to uncross your legs for me. Go ahead and check your pedal pulses while I'm at it. Okay. So, what I want you to do is I want you to not turn your eyes. I want you to keep your eyes straight ahead.
Mm-hmm.
Do not turn your head.
Mm-hmm.
What I'm going to do first is just check your pupillary response.
Mm-hmm.
Okay. If I can get this thing to go, there we go. Okay. His pupils are round, equal, and accommodating light. His eyelashes seem to be intact. Eyebrows are normal. They're the same shape and quality throughout. Both eyes seem to be normal in size. John, I'm going to have you close your eyes for me.
Mm-hmm.
And I want you to tell me if this is sharp or dull.
Sharp. Sharp.
Okay. And here's the dull one.
It's dull. Soft.
Okay. Good. We are going to check your olfactory senses right now. I want to kind of look up your nose just a little bit. I know that's just what you wanted to have done today. Okay, his nares are about the same size, same width. Nose is symmetrical. I don't see any kind of rashes or any kind of different kinds of skin textures on your nose. For someone who doesn't, who shaves their head and doesn't have a cap that they wear all the time, it's important to inspect the skin on the head and the face and the ears for sun damage, possible skin cancers, that kind of thing. But what we're going to do right now is we're going to test his sense of smell. So close your eyes and just let me know if you smell anything different.
Mm-hmm.
And what's it smell like?
Mentholatum.
Okay. Didn't know that was going to be a part of the test today, did you?
Mm.
Okay. So I'm going to kind of feel around here on your head. Have you noticed any kind of rough patches or any kind of scaliness or anything like that? Any weird lumps or bumps?
No, not that I know of.
Okay. So I want you to open your mouth for me. Now go ahead and clench your teeth for me. Good job. Go ahead and close your mouth. Okay, that didn't elicit any extra response. I'm going to have you go ahead and swallow for me. Okay, his thyroid feels intact. You haven't had any kind of surgeries or anything like that, right? Okay, so if I was going to, I looked at his ocular, just initial assessment. So now we're going to go ahead and look at his eyes, make sure that they track the way they're supposed to. So, without moving your head, look straight at my fingers. Now, I'm going to bring them out. I want you to follow.
I can only follow one.
No, I'm about to check your peripheral. Tell me when you can no longer see my fingers.
About right there.
Okay, good. Got good peripheral vision then. Okay, so now I want you to stare at my finger. Follow it up. Down. Over. Very good. Okay, so what we're doing there is just checking ocular movement, making sure that both eyes track at the same time in the same way. I want you to stick your tongue out at me and smile. So he's got, his tongue does not deviate. Smile is symmetrical. Go ahead and grip my fingers for me, if you will. Okay, now hold your hands like that and don't let me push them down. Okay, good. And do the same to me. There you go. Good job. Now, I want you to close your eyes and hold your hands out like this. A little bit higher for me there, John. Okay. Now, there we go. So they're at the same level, which means that his musculature is doing just fine and his innervation is fine as far as that goes. I want you to look over here to your right. He doesn't have any deltoid or tricep wasting that I can tell, or trapezoid muscle wasting. Look to the other side for me. Very good. Now, have you had any trouble with your ears? Okay, good. How about your vision? Has your vision been giving you any kind of trouble lately?
Yeah, I've been getting trouble seeing things up close.
Up close, okay. Well, I don't have anything for you to read, unfortunately. Okay, so you've been having a little bit of presbyopia, you think? A little bit of older eye vision?
Oh yeah. My doctor said that the lenses had started to harden a little bit and just aren't soft enough to focus on things up close anymore.
Oh,
I
okay.
need to have my eyes checked and do some corrective glasses or something.
Okay. How about your ears? Feel any clogginess, fullness, any kind of sinus issues at all?
No.
Okay, if I were going to assess his ears, if I had a otoscope, I would be looking in his eardrum, into his ear, looking at his eardrum to make sure that it's clear, it's not bulging, it's not red. You want to make sure that the ear canal is fairly free of debris, but there's a normal amount of cerumen that's going to collect, and you just want to make sure that the ear canal is intact and looks good. John, why don't you go ahead and lay down for me? Now, what I'm going to do is I'm going to talk you through the breast exam first. We're not actually going to do a breast exam on John, but breast cancer in men is a whole lot more common than you think. It's about 1 in 9, which is, John, how old are you?
46.
46. So typically, if breast cancer is going to be prevalent in a man, or if it's going to come about in a man, it's going to be about the age 68. So John has a few years to not have to worry about that. But if you ever have any testicular nodules, lumps, bumps, anything like that, or if you have any heavy drinking, any kind of injury to the area, any scrotal surgery at all, you need to start being more aware of what your breast tissue is doing. because those things are all common factors in men developing breast cancer. So, if I was going to do a breast assessment on him, I would first have him take his shirt off standing up, hold his arms out like this, hold his arms up like this, and put his hands behind his back so that you could make sure that all of the skin slides naturally over the muscle. You don't have any puckering, you don't have any orange peel looking skin texture. On the physical exam, what we would be doing is starting right here in the armpit or the axillary area and coming down. We would start. There's 3 different ways you can do it. You can do circular patterns, you can do kind of a spoked wheel effect, or you can do lines back and forth, which I tend to tell my patients to do whatever they're most comfortable with. But for me, just to make sure that I do it the same way each time, is I would start here in the axillary, go down to where the rib meets the stomach, the abdomen, and then we would go all the way back up to the collarbone and all the way to midline. Then we would start on the other side and do that as well. A thorough breast exam takes anywhere from 3 to 5 minutes per side. I realize that that's not the norm, but that's how long we're supposed to be spending doing these assessments. So, anywho, there you go. There's your little lesson for the day.
Thank you.
So I'm going to go ahead and listen to his heart, his lungs, and his abdomen, and palpate when necessary. I'm going to listen to your heart first. John has some nice clear heart tones. They are not far away. They're just where they ought to be. His maximal point is right here, where you can hear his heart the loudest. All of his valves are clicking and closing nicely. I don't hear any kind of turbulence, any kind of murmurs, anything like that. So now I'm going to help John sit up, and I'm going to listen to his back. We'll listen to your lungs here. Deep breath in. And out. In. And out. Again. Don't let me make you hyperventilate here. Okay, his lung tones are nice and clear, they're crisp. I don't hear any crackles, any rails, any kind of wheezing, anything like that. You don't have any kind of lung issues, do you, John?
No, not that at all.
Okay, good. While I've got him up here, I'm going to go ahead and look kind of at the musculature of his back. Make sure that there's no areas of wasting or, lumps, bumps that shouldn't be there. His spine should be nice and midline, which it is. You have any trouble with your back?
No, not right now.
Good. All right. Go ahead and lay back down. What I'm going to be looking at now is his abdomen. We're going to listen first before we do any kind of percussion or palpation, because you don't want to move things around and then listen. You want to always listen first. We're going to go quadrant by quadrant. You can just relax here, John. You don't have to do anything. I hear really nice bowel sounds. They're not too fast. They're not too slow. A good rule of thumb for listening to bowel sounds is you have to listen before you can say bowel sounds are absent in any area. You have to listen for at least 5 minutes in each quadrant. So that's 20 minutes of listening to the abdomen if you want to chart bowel sounds absent. So his are nice though. I'm going to go ahead and palpate. I don't feel a liver here. I feel just the edge, which I'm supposed to. So, oh, nice little tympanic. I don't hear any kind of, see, it's a little bit different there. But over here, you know, we hear nice crisp tones. We don't hear anything that sounds, it doesn't feel swollen, and we're not hearing muted sounds whenever we're tapping, we're percussing and hearing sharp tympanic noises, which is what you should be hearing. I'm not going to do a bowel, groin exam on him either, because that's not necessary. You just lay here. At this point, I am going to feel around though, just to make sure he doesn't have any kind of hernias in the area that I'm working in. And I'm also feeling for pulses. How about your legs? I know you said you had had surgery on one of your knees. Have you had any trouble with that knee since? No?
No, I haven't.
Okay, you've got good popliteal pulses. He's got good groin pulses. We're going to look at his legs here. Now, I noticed that John doesn't have a whole lot of hair on his legs. Has it always been this way?
Uh-huh.
Okay.
I do not shave.
His tone looks good. It's nice. It's even. You don't see any kind of blotchiness or any kind of petechiae or any kind of weird rashes. No athlete's foot or anything like that, right? Okay. His pulses are good. That's dorsalis pedis. And here's his posterior tibial. And those are both good. I want you to push against me, John. Pull back towards your head. All right. And we're going to look at his nail beds. And they look good. His capillary refill is just about instantaneous. It's not even a second, really. Let me look at your hands. Do kind of the same thing here. All right. They look good. Okay, John, last thing I'm going to have you do is if I could get you to stand up and just walk for me so that I can watch your gait. You don't use any kind of walkers, canes, crutches, anything like that. Okay, can you walk toward me? All right, can you turn around and walk back? Okay, and if you'll turn back around and go ahead and lean down, touch your toes a little bit there. Okay, oh, you have to come towards me, apparently. There you go. All right, that looks good. Okay, well, I think we've pretty much done a head to toe. Let me ask you a few quick questions, and I'll leave you alone. You don't have any kind of problems when you're urinating? No burning? No foul-smelling urine? Nothing like that? Bowel sounds normal? Or bowel movements normal for the most part? All right, well, everything looks good. You seem to be pretty healthy. Your blood pressure is a little bit high. You might want to take it a couple of times over the next few days just to make sure that, you know, it's not running.
That's not normal for me, so
yeah,
I do take it regularly.
Good. Okay. Well, I thank you so much for your time.
Thank you so much.
And that's it.